Multiple myeloma is an oncological disease. Look at this picture, shows that disease mechanism, X-ray findings. Look at this. CT findings and MRI. Look at this. Spinal cord compression. A detail going on. Introduction. Multiple myeloma is a malignant disorder characterized by the uncontrolled proliferation of plasma cells in the bone marrow, leading to numerous complications such as bone destruction, anemia, renal failures, and immune suppression. It is the second most common hematologic malignancy, primarily affecting older adults. Definition. Multiple myeloma is a type of blood cancer originating in plasma cells, a subset of white blood cells responsible for producing antibodies. It is characterized by the excessive production of abnormal plasma cells, monoclonal protein, M protein, and associated complications, including bone damage and impaired immunity. Types. 1. Smoldering asymptomatic multiple myeloma. No symptoms or organ damage. Detected by elevated M protein or abnormal plasma cells. 2. Symptomatic multiple myeloma. Presents with symptoms such as CRAB. Features: hypercalcemia, renal failure, anemia, and bone lesions. 3. Non-excretory myeloma. Rare type where M protein is not detectable in blood or urine. 4. Light chain multiple myeloma. Produces only light chains of antibodies detectable in urine as Jones proteins. Causes. The exact cause is unknown, but genetic and environmental factors are implicated. 1. Chromosomal abnormalities. Example: translocations, deletions. 2. Mutations in angiogenesis and tumor suppressor genes. 3. Possible association with chronic immune stimulation or infections. Risk factors. 1. Age, most common in individuals over 60. 2. Gender, more prevalent in men. 3. Race, higher incidence in African Americans. 5. Family history, increased risk with close relatives diagnosed with multiple myeloma. 5. Radiation exposure, prior exposure increases risk. 6. Monoclonal gammopathy of undetermined significance, MGUS, a precursor condition. Complications. 1. Bone damage, osteolytic lesions, fractures and bone pain. 2. Hypercalcemia, result from bone resorption. 3. Renal impairment due to light chain deposition and hypercalcemia. 4. Anemia caused by bone marrow suppression. 5. Infections due to immune suppression. 6. Neurological complications, spinal cord compression or peripheral neuropathy. Pathophysiology. Neoplastic plasma cells accumulate in the bone marrow, disrupting normal hematopoiesis. Overproduction of M protein impairs immune function. Cytokines, example IL-6, RANKL, stimulate osteoclast activity, leading to bone resorption. Renal damage occurs due to cost nephropathy, light chain deposition and hypercalcemia. Pathophysiology of multiple myeloma, step-by-step process. 1. Initiation of plasma cell malignancy. 2. Proliferation of malignant plasma cells. 3. Production of monoclonal protein, M protein. 4. Bone marrow microenvironment disruption. 5. Osteolysis and bone destruction. 6. Suppression of normal hematopoiesis. 7. Renal impairment. 8. Immunosuppression. 9. Neurological complications. This step-by-step cascade underlies the clinical manifestations and complications of multiple myeloma, emphasizing the interconnected nature of the disease's systemic effects. Signs and symptoms. 1. CRAB features. C for hypercalcemia. Symptoms include nausea, confusion, constipation, or renal impairment, fatigue, fluid retention. A. Anemia, weakness, pallor. B. Bone pain, fractures, osteoporosis. 2. Fatigue and recurrent infections. 3. Weight loss and night sweats. 4. Peripheral neuropathy. Diagnosis. 1. Laboratory tests. A. Serum protein electrophoresis and urine protein electrophoresis. B. Immunofixation to detect M protein. C. Complete blood count CBC for anemia. D. Serum calcium, serotonin and beta 2 microglobulin levels. To bone marrow biopsy to confirm increased plasma cells greater than 10%. 3. Image studies. X-ray, MRI or PET CT to detect bone lesions. For diagnostic criteria based on the International Myeloma Working Group IMWG. Nursing diagnosis. 1. Acute pain related to bone lesions. 2. Risk for infection related to immune suppression. 3. Fatigue related to anemia. 4. Impaired mobility related to bone damage. 5. Anxiety related to disease prognosis. Management. Medical management. 1. Chemotherapy. Primary treatment using agents like bortezomib, lenalidomide. 2. Targeted therapy. Monoclonal antibodies. 3. Stem cell transplantation. Autologous SCT activity in eligible patients. For radiotherapy for localized bone pain or spinal cord compression, 5. Supportive care. Bisphosphonates to prevent fractures. Erythropoietin for anemia. Dialysis for renal failure. Nursing management. 1. Pain assessment and administration of analgesics. 2. Monitoring for signs of infection and renal function. 3. Educating about medication adherence and side effects. 4. Assisting with mobility and preventing fractures. 5. Providing emotional and psychological support. Treatment. 1. Induction therapy, a combination of chemotherapy and targeted agents. 2. Stem cell transplantation for eligible patients after induction therapy. 3. Maintenance therapy, lenalidomide or bersimobib to sustain remission. 4. Clinical trials, access to novel therapies like CA or T cell therapy. Psychosocial medicine. 1. Psychological counseling for coping with chronic illness. 2. Support groups to share experiences. 3. Addressing the financial burden and work-related concerns. 4. Family education on disease progression and caregiving. Prevention. While multiple myeloma cannot be completely prevented, reducing risk factors such as avoiding unnecessary radiation exposure and early monitoring of MGUS can help. Prevention strategy for multiple myeloma. 1. Regular monitoring of precursor conditions. 2. Avoiding harmful exposures. 3. Maintaining a healthy immune system. 4. Managing risk factors. 5. Early genetic counseling. Although these measures cannot guarantee prevention, they can help lower the likelihood of developing the disease or catching it early for better outcomes. In conclusion, multiple myeloma is a complex, life-altering condition requiring a multidisciplinary approach for management. Addresses in treatment have significantly improved outcomes, but patients' concern care focusing on symptom management and quality of life remains critical. Ongoing research offers hope for future breakthroughs in prevention and cure. Thank you. Have a nice day.